So dermal fillers, particularly hyaluronic acid dermal fillers, have been really a game changer in the aesthetic market. And with that increased use, we're starting to see more and more people needing to dissolve those fillers as well. The question is, why is this happening? And is this the right choice for you? Hi, my name is Dr. Jordan Carqueville. I'm a cosmetic dermatologist and Mohs surgeon. And in this video, I'll break down some of the reasons that people dissolve their fillers. What does that process look like and what to expect? So let's start with why people are choosing to dissolve their fillers. Number one reason I see people dissolving fillers is due to misplacement of them. So sometimes if you're seeing someone who might not be a qualified injector, you may be injected in a place that is not anatomically correct. So this can lead to an overfilled or unnatural look. And so that would be a great reason to come in to dissolve that filler. Sometimes there's actually medical complications that occur, such as lumps, or even the worst case scenario, vascular occlusion, in which dissolving needs to occur immediately. Sometimes a lump can occur, particularly around the lips or around the eyes. And so that might require a little bit of a hyaluronidase or a filler dissolver to remove that. So let's talk about, how does dissolving filler work? We use hyaluronidase, which is an enzyme that can break down hyaluronic acid. If you were to put some filler in the palm of your hand and drip hyaluronidase on it, it will actually melt into water. The process is quick. Almost instantaneously, I can see a result when I inject a hyaluronidase into an area of unwanted filler due to that reaction. Depending on the filler type, the amount of its cross length, the thickness of that filler, it may take several sessions to achieve those results. So let's talk about what to expect after dissolving your filler. You may experience some swelling, some redness, maybe some bruises for a few days afterwards. And that's because we just injected all this fluid into the skin. And anytime you inject the skin, you could potentially get a little bruise. After the reaction takes place, you may feel a little hollowed out. It's because you probably were used to how you looked before. That doesn't mean you can't add more filler back into that area, but I would wait at least 6 weeks. The question becomes, is dissolving those fillers, is that the right choice for you? This is going to depend on any person's specific situation. If there is unwanted filler in a place it shouldn't be, if you're unhappy with the results, if the results look unnatural, if you feel overfilled, if you feel that your filler has migrated, those are all great reasons to get evaluated and get that removed. As always, we recommend that you see a qualified provider, someone who's experienced with injectables, to help manage the dissolving of fillers. If you have considered dissolving your fillers, I hope this video is helpful. If you want a fresh start or just a subtle tweak, it's always best that you feel great in your own skin. If you found this video helpful or you want to hear more about this topic, feel free to subscribe. Also, feel free to ask any questions down below or drop any comments. Thank you.